G'day everyone. Today I'm going to do a brief review of spontaneous coronary artery dissection, or Scad. It's worth being familiar with this condition. Some sources say that it represents up to 4% of cases of acute coronary syndrome and up to 25% of cases of ACS in women under the age of 50. So who does it affect? Well, in a nutshell, mostly youngish people and mostly women. The largest prospective cohort we have is the Canadian Scad cohort study, which is 750 patients. Their mean age was almost 52, and almost 90% of them were women. They tend not to have conventional cardiovascular risk factors, but in 80% of cases, they have one of the risk factors listed on the slide. 20% of cases are thought to be idiopathic. FMD stands for fibromuscular dysplasia. Connective tissue disorders include things like Marfan syndrome and Ehlers-Danlos syndrome. Together, these probably represent no more than 5% of cases. Inflammation refers to any systemic inflammatory condition. Postpartum patients make up anywhere from 2 to 18% of all comers with Scad. The hormonal changes of pregnancy are thought to weaken the arterial wall, which is why multiparity and hormonal therapy are also considered risk factors. These patients present like they're having an AMI. 96% of them will have chest pain. Less common symptoms include things like diaphoresis, dyspnea, neck pain, back pain. Almost 30% of Scad cases will happen during some kind of intense physical exertion. And in about half of cases, a significant emotional stress precedes the event. All of these patients are going to get an ECG, and a quarter to a half of them will have changes of STEMI, and this can be in any vascular territory. Up to 14% will have ventricular arrhythmias, and the troponin is almost always elevated. In less than 1% of cases, it will be normal. So these patients go to the cath lab, they have an angiogram, and that's ultimately where they're diagnosed. Management is usually conservative, but there may be a role for PCI in the more extensive dissections or even the ones that cause hemodynamic instability or electrical instability. So that's Scad in a nutshell. Thanks for listening.